Okay, and welcome back, everyone, to another episode of Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi. We are on AM 950 Radio, and as always, fired up and excited to be with you guys. Obviously, a lot going on in wellness, a lot going on in well-being. You guys hear me talk about this week in and week out, and when I am with my co-host Mandy or whether she's alone, a lot of the topics we've covered have really focused on the totality of our healthcare system, what's going on, what's good with it, what's wrong with it, how we need to combine things from, Western medicine, Eastern medicine, new technologies, alternative treatments. And, we've really enjoyed talking to you about that. But one of the topics, interestingly enough, we've been doing this now for a while. The show that I haven't talked to you about is what I've been doing for the last 20 years, and that is managing people with spinal problems. And I thought today, because of how many requests you guys have made, whether it's through listening to my show here or listening to my podcast, I thought I'd talk about navigating the complex maze of what is spinal health. And to be honest with you, it is so confusing. You really don't need to feel bad about you being confused when you have a spinal condition or your family has a spinal condition. You're hearing different things between social media, between what your providers are telling you, between what you're reading. And then you're just kind of like, what am I supposed to do now? And I thought we'd spend today talking about it. And the reason I don't want you to feel bad is because I work with many providers that are not either spine surgeons or in the spinal health market or kind of like sports ortho people or chiropractor, people that are used to seeing, spinal conditions on a day in and day out basis. And I can tell you, even my colleagues that are not into this, sometimes they are confused themselves. They don't really know, like, where do we send this patient? What do we do with this person? Where do we go? And then they themselves, even though they may be physicians or nurse practitioners or nurses or work in a hospital or in one of those settings, they themselves, because of the complex nature and how much is available to treat people, are also confused about what to do. So, what better, way than to spend our time together today than talking about how to navigate the maze of spine health, spine wellness, especially when you have a significant problem going on. And we're going to talk about, one, where to even start, and then talk about how different treatments are really dished out depending on where you start. And then we're going to talk about how to put that all together to make sure you're getting the right care. Because one of the things that I've seen time in and time out is if you're put down the wrong path of treatment, then sometimes that could lead to longer periods of disability, potentially becoming addicted on pain medications because you're in so much pain and you're not necessarily being sent to the right people to do the evaluation. You may spend a lot of money out of pocket and then only in retrospect realize, hey, I'm out, $5,000 or $10,000 because I went and did these fancy treatments, and maybe although those might be effective in some patients, maybe that wasn't the most effective for you, but you ended up going down that path for whatever reason. And the purpose of today's talk is not to say that this is the only way to do it, or you got to do this, or these people are trying to sell you something that's not real. It's really to help you, again, become CEOs of your own health. And today, let's talk about becoming the CEOs of your own spine health. And spine is such an important topic in today's society because so many of us are suffering from neck pain, back pain, all kinds of things related to the spine. And let's help you to help yourself get the right care. So on the other side of the break, we'll get into this, dive deeply, and hopefully make an impact on how you think about managing your spine care, the complex maze of spine care. And we'll see you on the other side of the break here on AM 950 Radio. Welcome back to Recharging the Human Battery Radio. I'm your host, Dr. Stefano Sinicropi. We're on AM 950 Radio. And like we said in the previous section, today let's talk about guiding you through the maze of treating your spinal condition when you're suffering from neck pain or back pain or thoracic pain or whatever, sciatica, radiculopathy. What do all these terms mean? Sometimes, to me, I talk about this stuff literally on a constant basis. There's not a day that's gone by in the last 20 years that I've not talked about something related to the spine. Obviously, as a spine surgeon with a busy practice, this is what we talk about. So sometimes to me, when I'm talking about these things, it's very repetitive, and I feel like I'm just saying the same stuff over and over, and sometimes I bore myself, but I know for you guys it's totally different, right? Because a lot of times people don't know what exactly we're trying to say, and my job that I've really taken on, not just as a spine surgeon, but as a wellness advocate, all the stuff that we're working on right now, is really trying to be your guide to cut through the noise and figure out what you should be doing when it comes to your overall health and well-being. But one thing that I can talk on for 10 hours in a row, 20 hours in a row, is what you should be trying to do for your spine health. And just to remind everybody, we're going to get into a little bit more terms and diagnosis and what to do. This show is absolutely not meant to give medical advice, but rather just to give you a guideline as to how you can best try to manage your condition, along with the experts that you're going to basically hire as your, let's just call it managers, or you're hiring, right? You're the CEO of your health. You have to hire people. So one of the ways I want you to think about it, like, for example, if you come and see me, it's no different than coming and seeing, right, an accountant or a lawyer or something like that, right? We sit down, we have a discussion, then you have to decide, do you want to hire me, right, to help you, to be your guide through this system. So let's talk about who you can employ in your own corporation as the CEO of your life and your body to help you along the path. So now that we've kind of had an overview of what I want to talk about, it's very difficult in a 1 hour period of time to talk about all the conditions that can affect us. But the big ones, right, are acute neck pain then radiating down the arm, which is called radiculopathy. Radicular, it comes from the word root, so a nerve root. So radicular pain, so pain going down a nerve root. So oftentimes if you have neck pain, you can have pain going down your arm. This is one of the most common things that I see. Same thing in the low back, where you have back pain. Back pain is one of the most common things in our society, right? 90% of people will have a very significant episode of severe back pain. Most of it is self-limiting, but then there's the people that then become chronic. And those are the people we tend to see. Or if you have very severe pain and it doesn't go away after a couple days, obviously you're coming into the system itself. So when it comes to the back, it's back pain and then potentially pain going down the leg. The lay term for that is sciatica, but we call it a radiculopathy, again, because your nerve roots are compressed. Then the pain's going down your leg. And what is your complaint? Doc, I've had this back pain, and man, now it's going into my butt. It's going down my leg. My foot's on fire. I have numbness, tingling, all of these other symptoms. And then there's the more serious things, right, that people get referred to. And that is when you have severe compression on your nerves, and then you're starting to have functional loss. So one of the ways you have functional loss is if you have weakness in a muscle. Right, so you can't raise your arm quite as well. You can't lift your foot quite as well, also known as a foot drop. Many of you are familiar with these terms. And then there are things like you have trouble going to the bathroom, or you can't control your urination. That's an emergency. That's called the cauda equina syndrome. Cauda equina horse. It comes from the word the horse's tail. And so when the bottom part of the spine, where all the nerves are in the lumbar spine, is really compressed, then you can have a severe something. And that's really an emergency. That you're going to end up in the emergency room anyway and have the appropriate treatment. So that's not really, what we're talking about today. You can have more subtle things, especially in the neck and in the thoracic spine or your chest region of the spine, where your spinal cord's compressed and you have subtle symptoms where things are not working well. You're losing your balance. You're dropping things. You have severe numbness and tingling in the hands. You can have all kinds of symptoms related to that. We call that myelopathy. I'm going to give a lot of definitions today. These are just some talking points to kind of understand what we're talking. What myelopathy means is spinal cord dysfunction. That means your spinal cord is compressed enough that something is going on, and whether that's a sensory problem or kind of numbness and tingling where you can't feel things or you can't sense where you are in time and space, having trouble walking, you're walking wobbly, or whether that's a motor thing, you actually have a weakness, your hands are weak, you're losing the muscle mass in your upper or lower extremities, those types of things. And so we deal with a lot of myelopathy. Other more severe things are cancers to the spine, or infections of the spine, or trauma to the spine where there's something very severe where you have a fracture dislocation. Again, a lot of those things, the treatment, it's very complex. That's a very, very complex discussion on how to treat all those. And I could do hours and hours of discussion, forums, and all kinds of things on those. And we're going to leave those for later. But what I really want to talk about today are the most common things, right? That's neck pain going down the arm, back pain going down the leg. So let's start here. How common is it? It is so common. There's none of you that are listening to this don't know somebody that's had acute neck pain or back pain or chronic neck pain or back pain. People that are on medications that have been treated for years, on and on and on. I mean, you all know somebody, but a lot of you are suffering from it yourself. And I could tell you, if we just said, hey, let's have 10 people call into the show right now, and 10 of you called in, and we say, hey, how did you get this treated? You're going to have 10 different responses. And that's where it becomes complicated, because it is a maze, and there's so much available to be able to treat you. And I want to talk about, again, without giving you medical advice, I want to give you a glimpse into the mind of a spine surgeon who's been doing this for a long time, who's seen, the pluses and minuses of a lot of different types of options for you and where you can go wrong, and just kind of take you through a general approach to how to get the best care for your symptoms, for your problem, how to get your life back, how to manage these things. Okay, so let's start here. Let's start with, how do you even get into the system? Okay, I'm not going to tell you what to do, but I'm going to tell you where people get into the system. So what are the most common ways? Okay, people go to their primary care doctors and they say, hey, I have this complaint. They go to their chiropractor. Hey, I have this complaint. Can you adjust me? Can you help me with this problem? They go to the emergency room or the urgent care room. You're going to then get a certain recommendation to go somewhere, and it may be to one of those first things that we talked about. You might start your treatment at a neurologist's office. Why? Because you have a lot of numbness and tingling in your arm. You've got a little bit of weakness. People say, well, maybe you have a neurologic disease, so you go to the neurologist, right, as your first stop. You might go to somebody called a physiatrist. That's a physical medicine rehabilitation specialist, a specialty that was developed after the World Wars to really treat people that have had all these different things. So they have a very broad understanding and treatment options. So that's always a good option. And you might start there. Okay, you might start at a naturopath's office or something. It just depends on what your beliefs are. You may even start at some type of a therapist's office or a psychiatrist or a psychologist. Why would you start there? Because you really haven't sought treatment for this pain that's been bothering you for 3 years, but finally your depression kicks in. Now you're starting there. So why do I bring up where do we start in the system? It's really important, and I talk about this a lot. The reason that it becomes confusing is because your starting point often determines what your next treatment steps are. All right. So just to give you if you go to the emergency room and you have a symptom, it's going to make a big difference where they send you. Right. So if they send you to the chiropractor, you're more than likely to have some kind of chiropractic treatment. If they send you back to your primary, it depends. It can go in any direction. If they send you to a spine surgery clinic, okay, and the two that I didn't mention are spine surgery clinics and pain management clinics, right? So if they send you to a spine surgery clinic without having other, workups or other things, then you're going to get a certain type of workup. And many times it's very broad, but in many times you might go to a spine surgery clinic and they're just wondering, what are you doing there? You're not even worked up yet. Okay, in our clinic, we do a lot of general workup, so we like to see those patients. To be honest with you, I like to see you guys as early as possible because then I can help you quarterback through that. But everybody's different. Some spine surgery clinics just really want to see things that are, operative stuff, and, it's variable. And then you might be sent to a pain management clinic where they're going to focus on maybe giving you pain medications or doing injections or things like that. So again, it just depends where you come into the system. If you go to a neurologist's office, you might have a certain type of evaluation. You might end up getting something called an EMG, nerve conduction studies, which look at the way your nerves are working if you're having pain, down your – and you might not get that at all, right, if you started with a chiropractor or you started with a spine surgeon's office. The reason that this is important, and I'm just giving examples because some of you are very familiar with this because you've been through it either yourself or through your family, and some of you have no idea what I'm saying because that hasn't happened to you yet, or maybe you're struggling to figure out where to go. The reason that's important, and the reason I talk about it so much, is because I believe very strongly through my experience and also through looking at how people's outcomes are. Two things. The two major things that we need to do. Number one, we need to treat you as early as possible. There is really, it's not disputable that if you have a back or neck condition, the earlier we get you into the right treatment parameter, the right treatment strategy, the better you're going to do. This is obvious, right? I'm not reinventing the wheel or anything. I'm going to just throw out something. Okay, let's say that you work in a lumber yard and you hurt your back. Obviously, the earlier we treat it, the better it is, right? Because what can happen if you don't go down the right path? What happens next? Now you're missing 1 week, 2 weeks of work, 3 weeks of work. Now nothing's working. Now you're on a narcotic medication potentially, or you're going to do all these. Who knows? But if we could have stopped that earlier, potentially, I'm not saying there's certain conditions that are going to need very high level stuff. But again, getting the right diagnosis and not having delays in your care. So one thing is we really need to be treating you as early as possible. So I'm just trying to give you general nuggets. The other big one, and it is one of my mantras, it's I have had that on my website for almost a decade and whatever. It's very simple. The right treatment requires the right diagnosis. And some of you, it might sound silly, right? It's obvious. Obviously, if I don't know what you have, I'm not going to give you the right treatment. I'm just going to give you some blanket treatment or whatever. But it is insane how many people I end up seeing in my clinic that have been going months and months and months, and they don't have the right diagnosis. They absolutely, and we're going to talk about some of the ways to diagnose things, again, from a very, very high level, and potentially on the next show we can dive into things you guys are most interested in. But if you don't have the right diagnosis, you can't treat people well. And patient after patient, and they've had good. It's not like they're seeing or people are not or trying to misdiagnose them or whatever. But there are certain nuances to treating the spine that can easily be missed, even if people are well-meaning. It can absolutely be missed. I'm going to give you some good examples of that when we get kind of back to talking about some specific conditions. So again, timing is critical in treating your conditions. We do not want these things to fester. I have so many people in my practice that before they started to develop their condition, they had incredible lives. They were athletes. They had great jobs. They were professionals. They were enjoying their family time. They were doing stuff. And they're coming to me a year later, 2 years later, 3 years later. They're broken. And when I look at the path that they took to get to this state of being broken, there are so many places along that timeline where we could have done an intervention. And when I say intervention, I don't necessarily mean surgery or procedures. I mean any intervention, but you got to target the right thing. Otherwise, the intervention's not working. I don't even have time to get into the opioid crisis that we've got going on, and it's somehow become controversial to even talking about it. But the truth is, it's not that as a physician I'm anti-opioid. It's that opioids for severe, acute pain, cancer pain, all these other things, or people that we really legitimately don't have options for. I'm not against it. It's not, I'm not against it. What I am against, though, is taking conditions that could absolutely be treated if people are put on the right timeline with non-opioid, potentially non-procedural options. And there are a ton of them, and we can talk about that, ad nauseum, and we'll talk about it a little bit. So those are really, if you take home anything that I'm telling you, we have to avoid these missteps. You have to avoid the missteps on the timeline as CEO of your own spine health, because I've seen it over and over and over. You gotta get the right treatments so that we can get you better as soon as possible. You can, if you don't want to listen to the rest of it, please just write that down. And let's really focus on that and I think we'll really help you by doing that. Okay, let's drill. I want to talk to you about what's in my mind when you come in. Okay, you go. So let's talk about preparation. The best way to see any healthcare provider is to be absolutely prepared. Remember, you're going to be the best CEO of your own health if you are prepared with the right questions and you've educated yourself. Never be embarrassed to challenge the physician. For those of you that are listening to this that are my patients, please come in and challenge me. I really, really do enjoy it, because if you challenge me and I don't have an answer, that means I don't know. Right? I don't really know. It's my job to learn about it specifically for your condition and give. So always, and I don't mean it, and this is not, we are a partnership. Okay, we're doing this together. My job is to empower you to get better, period. My job is not to sit there on a high. Now, if you have a condition that requires urgent surgery, you're going to be paralyzed. Obviously, I have to ethically tell you that, and I will be but it's your life. But again, we're talking about you being prepared for the visit. So write everything down. Be ready to ask questions. Be ready to ask what is offered, and be ready to ask what that particular person offers and what their circle offers that they refer to, and make sure it's wide enough and broad enough. So let's talk about a specific condition. Again, we are limited somewhat by time. Let's talk about neck pain first. And that is obviously something I see constantly. So we'll do neck, and then we'll try to do back if we have time, which we should. So if you are suffering, let's talk. There's a couple different ways that people present. You can present with a problem that's been going on for a long period of time, neck pain, and then you can present with something that is acute. So, for example, you had a motor vehicle accident. Now your neck is killing you. Maybe you have some pain down your arm, and somehow you found your way to my practice. Now, again, I can't speak for other people. Hopefully, if there's a diagnostic dilemma or people can't really figure out, then they're referring it into spine experts, which they should. because then we can really help to quarterback their care. And that doesn't mean I'm not going to refer them back to that particular person. It's just sometimes you need somebody that's pretty much dedicated their entire life to studying this, to taking care of patients, to referring people for, medications and procedures and non-procedural, conservative care. Anyway, let's go back to the neck pain issue. So you come in with neck pain. So spine management is absolutely an art. So when you come in, what am I going to do? I'm going to review your scans. Okay, so I'm going to look at your x-rays. I'm going to look at your MRI scans. I'm a spine surgeon, so typically I'll have that. If you didn't have that, then typically we want that, because if you're getting to that point, that means whatever conservative treatment you've had really hasn't worked, or you're in too much pain and we really need to figure out immediately kind of what's going on. So here's what you really need to know about when we look at scans. A lot of times, if you have chronic pain and even acute pain, many of the times it is still, with those scans, unclear specifically what is causing your pain. And this is so important. So a lot of you will come in and you'll say, oh, hey, I saw this and I looked at the MRI report and the radiologist is saying, oh, at this level I have this and at this level I have this. And we assume that, not we, but the patients assume that this is causing all of their problems. That may or may not be true. That's where the art of medicine really comes in. And so when we look at MRIs or we look at x-rays, right, before we do that, that's in conjunction with having taken a history and doing a physical exam. So what am I trying to do? I am trying to correlate what you are telling me, where your neck hurts, where it goes down the arm, what the timeline, what the sequence of events, what treatments you've had to that point. I have to take all that into account, and then I try to tie it in to what your scan looks like. And so I'll give you an example. So if you come in and your neck is killing you and you have pain in your forearm, the first thing that pops into my head just generally is, if it's coming from the neck, it's probably a problem coming from the C6 nerve, the C6 nerve problem. So what am I looking for? When I'm looking at the scans, I'm looking to see if you have a compression on your C6 nerve, because that would fit perfectly with your scans. We call that being in alignment, right? Everything you say, that's what we love best. Your history, your exam, and all the pictures, boom, it's right there. Oh, obviously that's your problem. I will tell you, as a longtime practicing spine provider, that is, sometimes that's the case. Many times it's absolutely not the case. And that's where we have to be real careful, because even as a spine surgeon, even though I'm an expert, I've been doing this for a long time, just because I have that, if it doesn't quite fit, I may not know what's wrong with you. And that's where we have to do more advanced things to try to treat you. So let's talk about, so you have neck pain. Here's an example. So you come in, you've had this neck pain, you had a fender bender, your neck's killing you. It's been going on now for 2 months. You've seen a couple people, nothing's working, you come in. You're telling me, hey, my neck is killing me. And sometimes I have some numbness and tingling in my hand. So I have something in my head. I look at the scan. Boy, that doesn't really make sense, right? I don't see that. I don't see a compression on the nerves that go to the hands. I see a bunch of bulging discs. I see a bunch of arthritis. I see all this stuff going on. So what do I do? Like, how do we all do that? Well, one of the things I'll tell you is different people are going to attack this differently. Some people are just going to treat you with a very, broad, hey, let's try this, or let's try this other thing, or, let's do this. Let's do physical therapy. Let's do this. I think that's all fine. Again, we talked about it on previous shows. As long as things are safe that you're trying, it's fine. I just don't want you to be in a position where, especially if you are having trouble functioning, you're having trouble going to work, your pain is severe, you're on pain medications, and so on. And so what I do at that point, if I really don't know, is we develop something called a differential diagnosis. And again, for some of you guys, if you're listening and you're a provider, obviously some of this stuff you're saying, well, I know all this, tell me something I don't know. But most of the audience is not going to know this stuff, and that's why it's important. So what am I formulating? I'm formulating a differential diagnosis. What's a differential diagnosis? Well, in our minds, we need to make a list of what are the different potential diagnoses that are causing your neck pain and the pain going into your arm. And you really want to be a part of that discussion with your providers. And if they can't give you a differential, or they're like, who knows, I don't think that that is the right way to do it. I think that we really need to make a list. And so we do it from most likely to least likely. And it doesn't have to be 30 things, but I will tell you, the structure of the spine is very complicated, right? We have discs. We have something called facet joints. We have uncovertebral joints. We've got the spinal cord. We've got nerves. We have the ligaments. We have other soft tissue around it. We have the capsules that are around the joints and so on again. And then we have the muscles, and we have the fascia, which are the planes in between the muscles. All of that can create the symptoms I just said before. So already I just threw into this big, soup of things. I just stirred into the pot all these potential things that could be causing your symptoms. But what I need to do as an expert, I'm just trying to get you into my mind, is I'll give you what's it called, the differential diagnosis. This is very important because each of those differential diagnoses, we're going to really approach those in very specific ways. And then, number one, try to get you the best diagnosis that we can and really limit it. Okay, this is really what it is. And then we're going to get you down the right treatment algorithm. So let's talk about the differential diagnosis, right? So you have this neck thing. You're in pain. You're tearful. You're just sitting there. I'm talking to you. You just want answers. So now I look at your scan. It's kind of a mess. You've got all this stuff going on, right? Bulging discs and maybe some stenosis, but it doesn't quite fit with your symptoms. So what is my differential diagnosis? So number one, any of those things that we talked about, those structures can cause this type of pain, especially when it's not crystal clear. So that's number one. If you've had a trauma, there's something called the whiplash injury, which you guys have obviously all heard about. You see it on the movies where people come in with their collars, right? They've had the whiplash, whatever. That is a very general, broad term. But when I think about like the whiplash injury, I think about injuries to all of the structures sort of simultaneously. So in a whiplash injury where your neck goes forward and back or side to side, depending on the collision, you can have injuries to your discs, you can have injuries to the joints, all those structures that we talked about. But the problem with a lot of whiplash injury is you can't necessarily pinpoint it or you can't see it because it's what we call non-focal, non-localizable. If you just had compression on one nerve and everything fits, that would be called a focal, localizable symptom. I'm talking about if you, doc, my neck is killing me. I have headaches every day. I have pain in my jaw. I'm just not well. There's something going on. I just get up in the morning. I might be okay. And then the second I start getting active, my neck, my shoulders, I have pain in my traps, the pain between my shoulder blades. One of the most, I hear this 10 times a clinic. So now I have to formulate a plan. And I'm acutely aware that the plan that I formulate for people is critical. It's critical in improving your quality of life, and I want to be as precise as we can. So when it comes to a situation where you just have neck pain, in those situations, I'm much more likely to take you down a path of different treatment options and algorithms, right? So sometimes we'll use some anti-inflammatory either medications or non-medications, things like omega-3s, changing your diets, things like that. We want to get your inflammation down. We use physical therapy and chiropractic care. Very, very important to try to reduce that inflammation. Huge proponent of something called class 4 laser therapy. Again, this attacks a very broad segment of all those structures at one time. What does it do? It improves blood flow. It decreases swelling. It improves your mitochondrial health, and that also decreases inflammation. There's a whole host of other biohacks that I really like. If those things are not working for neck pain only, then the next step for me would be to consider, higher level things. So in the whiplash, scenario, if you're not getting better with any of those things, and again, I'm not including everything because again, it's beyond the scope of this, and we can get into it on later shows. But again, this show is more about general wellness and things like that. This is not a spine surgery show per se, but I thought this would be a good time to talk about it. If you have not if you don't have improvement or you see me and you're not improved and you've tried some of those things that I just laid out, then we can do a series of different testing to see what is creating your symptoms. If you have some nerve impingements, but yet you just have neck pain, then one of the things that I do in my treatment algorithm is I'll put you through diagnostic injections, usually with lidocaine. Sometimes we'll use steroid to try to treat you, but the lidocaine will tell me. So, for example, if you have pain on the right side of your neck, nothing in your arm, and you do have a disc bulge around, let's say, your C5 nerve root, which would go into your shoulder, but you're just having pain in the neck or maybe between the shoulder blades, we then really need to get a diagnosis, because if we know that it's that C5 nerve, then it changes the way we treat you. So we'll send you for a diagnostic C5 nerve root injection or something like that. Okay? In a scenario where we don't have anything around the nerves and it's not clear, but you have a lot of bulging discs, we might send you for something called an epidural injection, which I tell my patients is like giving an aspirin to the nerve. Basically, they'll inject, it'll get everywhere, it'll decrease the inflammation in the area. Number one, if it's related to bulging disc or nerves, it should help you at least for a while. It also kind of gives me a sense of whether if it's more of a disc problem or whether or not it's not, if that doesn't do anything. Okay, again, complicated, but trying to get to the heart of what happens. One of the most important diagnostic tools we have for a whiplash injury and or for neck pain, when those other things haven't worked, right? We've gotten your inflammation down. We've tried the biohacking. We've tried the therapy, the chiropractic, all these other amazing tools that we have, is something called medial branch blocks. What medial branch blocks are is we numb the little nerves, okay, not the nerve roots, but the little nerves that come off of the nerve roots that then give the sensation to those joints that may have been injured, and those are called the facet joints and the capsules. And when we do that, if we numb that area and you get dramatic relief, that gives us a good diagnostic tool, basically saying, hey, your pain is absolutely coming from the injuries you've had, that soft tissue injury around your joints, and then we have a treatment algorithm for it. Once we do that, my preferred treatment is, if for those that really don't want to do anything procedural, preferred treatment algorithm is really focusing on things like class 4 laser therapy, which is excellent at addressing, again, inflammation and swelling that for something that you can't really see, but now you've diagnosed. So that's one of my go-tos. If that doesn't work, or people prefer to go more in the procedural route, and again, I have this frank discussion with all my patients, but at least now we're pretty sure what's going on, then we can target them with something called radiofrequency neurolysis. And the lay term for it is burning of the nerves. It sounds dramatic. I don't want you guys to get nervous or anything. Another thing that I use, I say it's kind of like a root canal. It really doesn't hurt. It's not a painful procedure. I mean, there's some discomfort, but it's not a pain. And the pain management guys do this. And what it can do is it can basically microwave those little nerve endings with these little probes. Again, it's not a big painful procedure. It's very minor. This is an outpatient thing. You have it done, you go home. And that can improve your symptoms for 3 months to sometimes over a year, while your body is regenerating those tissues and trying, to heal you. Very, very last resorts, if none of those things work, as we take you through the kind of the diagnostic algorithm, and almost this discussion I'm having with you now is the discussion. I have this discussion every single day with my patients. Every single day. And again, I answer their questions based on this. If all that doesn't work and the patients are clearly getting worse and worse and worse, there's other diagnostic tools that we can use to then look and see whether or not then, as a last resort, they may be in the category of potentially needing something surgical. And I will tell you, even as a surgeon, surgery is always the last resort for especially neck pain. It is much higher in the treatment algorithm when we're talking about pain down the arm, numbness and tingling, and especially spinal cord compression, where surgery is very high on the list of things to do. So as you can see in this discussion, and again, we can't really get into all the nuances of it because then I'd have to get really technical. But as you can see, I'm somebody that has dedicated the last 20 years of my life to treating these conditions, and I just spent the last 30 minutes talking about how, in my mind, I'm categorizing, number one, how do I get the right diagnosis? Because if I don't have the right diagnosis, I can't treat you right. And number two, what then? So I have a differential diagnosis. This is the second thing I want you to take. You really need a good differential diagnosis. And then the second thing is you really need a good treatment algorithm that is specifically designed based on the differential diagnosis. And that is a way that we can really help you to get to the root cause of your symptoms and, again, arrest that timeline and get you better, get you back to work, get you feeling better before we get into a chronic, we can't reverse the situation type of space. So on the other side of the break, we'll wrap this up. Sorry I didn't get to the long. I had a feeling I wasn't going to get to the back because this is just so exciting, at least for me. Hopefully it's a little bit exciting for you guys. We'll see you on the other side of the break. We're on AM 950 Radio. This is Dr. Sinicropi. We'll see you in a minute. All right, I hope your backs and your necks are feeling okay after that long discussion on differential diagnosis and treatment algorithms. This is Recharging the Human Battery Radio. I'm Dr. Stefano Sinicropi. We are on AM 950 Radio, and boy, does the time move quickly, especially when I'm talking about things that I'm so passionate about. You know, I talk about frequently. Every day with my colleagues, with my patients, with anyone that'll listen to me, frankly, on how important it is, right, to get the right diagnosis and then to get the right treatments and not be in that spiral, right, that death spiral, we'll call it, where you're just going around and around in circles and not getting the help you need. So let's talk about very briefly, and then we'll wrap this up. So very briefly, one thing, because I may not have covered it in the first section, but I want to talk about a little bit about the lumbar spine, and again, getting the right diagnosis. And there's one thing that I just can't leave this show without talking about, and that is how often people are diagnosed with disc problems. Okay, I'm just going to be very, very broad. Oh, you have a bad disc. That's why you're having back pain, or that's why the pain's going down your leg. But it's actually something called sacroiliac joint pain. Sacroiliac joint pain potentially represents up to 50% of acute low back pain flare-ups that end up in the urgent care room or in the emergency room. I cannot stress to you, going back to differential diagnosis, how important it is for us as spine health experts to make that right diagnosis. I have seen people get a huge number of treatments for their low backs, including injections, surgeries, traveling out of the country, stem cells, all these other things, and then it ends up that their actual problem was a sacroiliac joint problem. And that is a completely different treatment algorithm that has a totally different way of treating it. And it's really incredible. One example, I had a guy did 3-level disc replacement surgery. He flew to France to have this procedure, okay? And he comes in writhing in pain. Nothing's making him better. Eventually, I got him to a surgeon that does sacroiliac joint fusion, got 100% relief in his symptoms. Okay? Think about how much time he lost. Why? Wrong diagnosis. Got to be very, very cautious of that. So everything has to really rely on right diagnosis leads to the right treatment. Right differential diagnosis allows us to really pick what then our treatment strategy is. So those are really the take-home messages, because you guys really need to learn how to be in charge of your own health. So hopefully, just having listened to me excites you to do some of your own research. Go online, read about some of these things, read about what differential diagnosis is, what treatment algorithms are for specific conditions, and then ask those questions. when you come in to see whatever provider we mentioned at the beginning, because again, you may enter the system at any point. What am I trying to do? I'm trying to minimize medications you're on. I'm trying to minimize you having procedures of any sort, you having surgeries, by getting to the problems early. Sometimes you need surgery. Sometimes you absolutely need surgery to save limb. And really, we're not exaggerating, but most of this can be handled, and it's handled best early on. So talk about this stuff. Bring it up to your providers. If you're not happy with your care or what's going on with you or your family, make sure you seek second opinions, third opinions from different specialties. Let's get the right diagnosis. Let's get you on the right treatment path. Let's get that spine healthy. And on that note, we've got a wrap for today. Thanks for joining Recharging the Human Battery Radio. Today's Recharging the Spine Radio. And we will see you on AM 950 Radio next week. Take care of yourselves. Take care of your families. And again, be the CEOs of your own health. Have a wonderful upcoming week.